Mammograms, of course, they're recommended for every woman starting at age 40, but that does not mean that's when the risk starts. Brittany spoke with a breast cancer patient in her 20s, currently battling this disease, who has an important message for every woman out there. Brittany.
Yeah, she does, Holly. So she says her best advice is pay attention to your body. You know it best. At first, she says she was told that she likely felt a cyst in her breast, but after a second opinion, she found out she had breast cancer. At just 27 years old, Kara Wigfall was diagnosed with breast cancer.
I went from a healthy 27-year-old working out, eating right, dieting, to finding out I had breast cancer.
Diagnosed after getting a second opinion from a doctor, the lump was first found on her own.
I did a self breast examination and I felt the lump. It was like the size of a golf ball, like no kidding.
Self-breast exams are something Wigfall has been diligent about because of her family history.
I do have history of breast cancer on my mom's side and on my dad's side. I'm the youngest in my family to have it.
But regardless of their family history, TriStar medical breast surgeon Dr. Mark Cooper says self-exams are something every woman should do monthly starting in their 20s.
I tell patients there's 365 days of the year. You don't have to do anything for 353.
Dr. Cooper says it's a monthly practice to continue through your life. But in your 30s, add a physical exam with a physician. And then at 40, start getting mammograms.
Well, the CDC says that there's going to be about 255,000 cases of breast cancer diagnosed each year. Now, the majority of those are going to be later in life, but there are some, and I have patients who are diagnosed in their 20s and their 30s.
Although a small percentage, Wigfall knows firsthand why it's so important to pay attention to your body, no matter your age, and advocate for your health when you know something is wrong.
What I've learned through this experience is that your body will tell you when something's wrong. You just have to listen close enough. Breast cancer is not a death sentence. It's not a death sentence at all. I looked at it as a second chance in life.
And Wigfall tells me that she will have a double mastectomy to try and prevent it from ever coming back. Now, she's been undergoing chemo, and I am happy to report today, Holly, is actually her final chemo treatment. So once she goes to the hospital, she'll be ringing that bell later today.
Yes.
A huge day for her. So excited. Yeah.
That's part of their tradition.
I know.
That is huge.
Yeah, it's huge. It's incredible. And when she told me the exact date, I was like, that's when we're running your story. So I'm really excited to tell her story today.
So happy for her. But
Yeah.
again, once a month, that self-exam so
Have
important.
to do it.
Yes,
yeah,
absolutely.
write it down, keep a journal, do drawings, anything you can do to keep track of it for sure.
Even in your 20s, folks.
Yeah.
All right.